Hey everybody! I'm going to be talking today about my class discussion summary in which I posed the question, are medical school students provided with enough nutrition education? Some questions that I had asked in my discussion thread to get the conversation going are, should U.S. medical school students be provided with more nutrition education overall? Should there be a required minimum amount of nutrition ed hours for U.S. medical school curriculums? If so, how many? Is nutrition education in other countries different from that in the United States? Why is this discussion important? The Dietary Guidelines for Americans 2015-2020 edition states that half of American adults have at least one preventable chronic disease. More than 2/3 of adults and 1/3 of children are overweight or obese. And in 2012, new diagnoses of diabetes cost $245 billion in medical expenses. Additionally, the 17th Annual Gallup Survey of Americans surveyed 1,025 adults 18 and older from all 50 U.S. states and the District of Columbia. These adults ranked nurses and medical doctors as the most trusted professionals of 2019. So, given the rise of preventable chronic disease and the fact that doctors are apparently some of the most trusted professionals, and that nutrition and lifestyle choices can prevent and treat chronic disease, as we all know, I think that this conversation is a really important one to have because doctors should be trusted by their clients to be able to provide the basic nutrition education necessary to teach clients about a healthy lifestyle as it relates to preventing chronic disease. Additionally, I think it's really important that doctors are educated on the importance of working alongside registered dietitians and other highly qualified nutrition professionals when treating patients, especially making sure that they're understanding how to make a referral for their patients and when it's necessary to do so. Currently, in the United States, the Liaison Committee on Medical Education is the accrediting body for all medical schools. The American Council for Graduate Medical Education sets the required competencies for these medical schools. In 1985, the Institute of Medicine put out a report recommending that 25 to 30 hours is included in all medical school curriculums for nutrition education. The National Academy of Sciences agrees with this recommendation of 25 hours. However, regardless of the recommendations that were made years ago and still stand today, the 2018 medical school requirements still have no mention of required nutrition education hours. The first study that I reviewed gave insight into the nutrition education situation in the United States. The researchers surveyed nutrition education coordinators at all 133 U.S. medical schools with a 4-year program curriculum. They questioned the extent and the type of required nutrition education in the 2012-2013 academic year. They had a 91% response rate, which equates to 121 institutions. The results showed that 71% of U.S. medical schools failed to provide the 25 hours of recommended nutrition ed. This number actually decreased from 73% in 2008. 36% provide less than 12.5 hours of nutrition education. That's less than half of the 25 recommended hours. 18% of these schools have a dedicated nutrition course that is solely dedicated to nutrition information. This table was pulled from this article because I wanted to highlight for you guys the average hours of required nutrition education over the last 12 years. As you can see here, From 2000 to 2004, the requirements increased. However, from 2004 to 2008, they decreased, and from 2008 to 2012, they decreased even further. This next study looks at the required nutrition education in Canada. The researchers surveyed 9 out of 17 medical universities across Canada. The 23-item survey was provided in English and French to undergraduate medical school students that were in at least their 8th month of medical school. 933 medical students responded to the survey. The results demonstrated that the mean satisfaction of nutrition education was 4.7 out of 10. This was a significant finding. Students were uncomfortable discussing the role of nutrition in the prevention of disease, nutrient requirements, and the sources of nutrition information with patients in the future. 87.2% believed that they should have more nutrition education in their medical school curriculums. So how does the United States and Canada compare to other countries? In Europe, nutrition education is a requirement in 68.8% of institutions, with an average of 23.68 hours of teaching nutrition ed. In West Africa, medical schools are actually dedicating 57 hours to nutrition content. And specifically in Nigeria, they have just adopted a new curriculum in 2012 with a full emphasis on human nutrition. And lastly, in Australia and New Zealand, they have 5 nutrition-related competencies required for all curriculums. This next study sheds some light on doctors' perceptions of their nutrition proficiency. In 2017, the researchers surveyed cardiologists, fellows in training, and cardiovascular team members. They questioned them about their history of nutrition education and their attitudes about nutrition interventions with patients. 930 participants responded. 90% of these participants received no nutrition education during their fellowship training. 59% received no nutrition ed during their internal medicine training, and 31% received no nutrition ed in medical school at all. 8% of cardiologists reported an expert level of nutrition knowledge. But ironically, 95% of these cardiologists feel that it is their responsibility to provide the nutrition education to their patients. So let's go back to the research questions. Should U.S. medical school students be provided with more nutrition ed overall? Yes, the research in the literature has shown that majority of schools do not provide the recommended 25 hours of nutrition education. Should there be a required minimum amount of nutrition ed hours for U.S. medical school curriculums? If so, how many hours? Yes, given that the majority of schools do not even follow the recommendations of 25 hours, I think we could start out at 25 hours as a required bare minimum of nutrition ed hours. Is nutrition education in other countries different from that in the United States? Yes, Europe, West Africa, Australia, and New Zealand have more nutrition ed hours than the US, UK, and Canada. So what does this mean for RDs and for us? As of now, physicians are ill-equipped to add nutrition-related interventions to their treatment plans. They actually feel this way too. It's essential for registered dietitians to be included in the care plan for every patient who is suffering from or at risk for a nutrition-related chronic disease. After all, we are the experts. The importance of nutrition is key for physicians to understand when referring their patients to a highly qualified dietitian for nutrition and healthy lifestyle interventions. Here are my references. And thank you all for listening.